Hey guys, so I wanted to go over a topic that I get asked about a lot, which is teeth clenching. So a lot of people will get pain up through here, they'll get pain in their joint, doesn't feel great on the teeth. So what I want to dive into is why exactly this happens. So just a real quick anatomy overview. We got the jaw that's connecting right here to the skull. This is called the temporal bone. We got a big muscle that sits right there called the temporalis, and whenever you bite, like when you feel it pulsing right there, that's that temporalis bone that's squeezing down. Now obviously, makes sense that if you're clenching a lot, this muscle will get fatigued, it will get tight, that can be uncomfortable. But what I want to get into is why. Why does that happen? What's going on with the clenching? What do you do to move forward? So clenching, the rabbit hole goes deeper than most people think, because 99% of the time it gets talked about purely as a dental issue, which is obviously very important. It's pretty obvious to see that if your teeth aren't in a good spot and the jaw joint's pressing up into that space, whenever anything gets irritated, muscles tend to contract to try to protect yourself, and that's true all over the body. So again, temporalis, usually when it's squeezing, it's trying to help with something. But yeah, if your teeth aren't fitting together well, that can jam up that joint. If this jaw bone is in the incorrect position, that can jam up that joint as well, and that can feel really uncomfortable. The other thing that happens though is a lot of times the skull is not sitting on top of the neck correctly. So what I see for people is they have turning, bending, compressing, and right along with that, the top teeth are part of the skull, and they're gonna come down right into this jawbone right here where the disc sits. Same thing, temporalis clamps up. So from a structural standpoint, the teeth and the jaw need to be in a good position. The head and neck also need to be in a good position though. So as an upper cervical chiropractor, I see this gets missed all the time. We have to have that good foundation for everything else to pivot off that correctly, and that can be a big thing that comes up for that clenching and that pain that comes in right through here. So structural issues are the first reason that people clench. Second reason is neurological issues. There's something called proprioception, and that's really a fancy name for we have sensors all over our body that are continually feeding information up to our brain so that our brain knows where it's at in space. And good proprioceptive input is actually really important to the functioning of the brain. If we don't get good proprioceptive input, we tend to get overactive. The brain tends to get into more of that fight or flight mode. And so we need to have good proprioceptive input for the brain to function correctly. If we're not getting good signaling or proper signaling for that mechanism, what happens is your brain is like, I need some of that proprioceptive input. And guess what? Jaw joint is really rich in proprioceptors. So by getting a good squeeze, your brain gets that proprioceptive input that it's looking for. But obviously if you're doing this day in and day out, that's not great for that joint, and that clenching, you don't want to rely on that for the long run to give your brain the proprioceptive input that it's looking for. So again, there can be neurological implications, and this can piggyback right off the structural side of the equation. If things aren't in the right position, if things aren't moving correctly, that can all play into that proprioceptive conversation. The last thing that's super important, I'm going to actually do a separate video on this because it's more, again, this goes pretty in depth, but your airway. So while you're sleeping, if you're not breathing, if you're not getting good oxygen, and if your brain senses that air isn't moving properly, then moving your jaw down and forward is gonna have a tendency to open up the airway. And clenching's an easy way to do that. So if your brain is sensing it's not getting enough oxygen, clenching usually results as well. So a lot of people are nighttime clenchers, and not everyone realizes that's almost always an airway issue that ideally would be addressed so that's not a long-term thing for you. So let me know if you have any questions in the comments. Again, clenching is something that so many people deal with, but the full picture isn't oftentimes discussed. So love to talk about any specific questions you have. I'm gonna be coming out with that airway video so we can talk more about that, and I'll look forward to seeing you over there. Thanks guys.